The Clinical Skills Assistant is an initiative that has been supported and funded by Cascade. It aims to recruit medical students as volunteers to work in Queen's Medical Centre Emergency Department. You'll focus on strengthening your clinical skills, such as things like taking bloods, doing cannulas and catheters, but with feedback from your mentors who'll be experienced ED staff. We've worked with Frank Coffey, Head of Service and Director of DREAM, as well as a brilliant team who have been really enthusiastic about the project.
So the team in the emergency department are really thrilled to be working with Tulsi on this exciting project. We know the pandemic has made it really difficult for medical students to come in and have an opportunity to work in clinical areas, and it's particularly difficult to get the confidence about doing these skills repeated times. We practice what we call hybrid simulation, where we can take the part task trainers that you would normally practice on and affix them to a person, to a simulated patient, so that you have to be talking to somebody while you're taking the blood or while you're putting in the cannula, and they'll be asking you questions like, is this the first time you've done it, and what are the complications? And having the opportunity to practice that in simulation before you go out into real patients is a real confidence booster.
Learning from nursing staff will give you a stronger understanding of the nursing role in ED, as well as how we work together as a multidisciplinary team. Within ED, we're recruiting mentors to help you improve your skills. They'll be helping you to develop both clinical and non-technical skills to ensure best practice, regularly reviewing your progress, while supporting the department to deliver excellent care without exception.
Being a medical student myself, I know firsthand the lack of consistent opportunities that we have to practice our skills. I've worked in the emergency department for a few years, and I've realised that there isn't actually any shortcuts in developing genuine expertise in something. If it wasn't for my job as a clinical support worker with repeated exposure, I wouldn't be in the position I am today, and that's why I wanted to develop this role.
So, who are we after? You might want to gain experience and practice your skills in a frontline setting. You might want to build some confidence and fluency in a clinical environment. You might actually lack confidence in certain areas: communication, dealing with the public, prioritising workloads, or anything you feel this role can help you with. Basically, if you have a commitment to developing your skills and abilities while contributing to high quality work on the front line, we want to hear from you.
The emergency department at NUH is one of the biggest in the UK. We see about 700 patients a day, and it's in fact one of the biggest in Europe. It's also a major trauma centre for the East Midlands region. I teach a lot of medical students, and the feedback we get from all learners, not just medical students, is what a friendly department it is to come and learn, and how receptive and open people are to teaching. We're really grateful to Cascade for providing the funding to enable us to deliver this training and to support you when you come to the emergency department. I know that if I had this opportunity when I was a medical student many years ago, I would have jumped at the chance. So I'd encourage people to take this opportunity to come and work with us in the emergency department and learn these clinical skills, and also in doing that you'll be helping us in the department as well.